This finding can impact future research because it can tell us basically what are the mechanistic targets to look at when you're trying to examine what role sleep might play as a outcome of the effects of Alzheimer's pathology or as a instigating factor. And it tells us that inflammation and neuronal integrity are important pieces that connect Alzheimer's disease with sleep. And if you have targets that affect those, that might actually be able to preserve sleep or preserve cognitive functions. It also tells us that you might be able to instigate and examine what happens when you locally enhance the expression of some of these brain waves during sleep. Does that impact the buildup of some of these biomarkers? And so this really sets the stage for a targeted mechanistic intervention that looks at how intervening in local sleep might impact Alzheimer's disease. And ultimately, I think where we want to go from here in the sleep field is we want to understand, does sleep disturbance play an active role? Or is it just a sign of a disease process? And this is something we don't really know yet. There's a variety of sleep disturbances that we know prior to this that are associated with other neurodegenerative diseases that may simply be an early sign of the oncoming oncoming onset of a degenerative disease. Like, for example, Parkinson's disease, we know that a very large number of those patients first initially, years before, develop something called REM behavior disorder, where they lose the ability to inhibit their body's movements during sleep. And so they act out their dreams. And it turns out that this is an early sign of the degeneration of the motor system that leads to Parkinson's disease. So if you improve that REM sleep and improve the control of it, that doesn't necessarily say you're going to stop Parkinson's disease. But it might also be, in the case of Alzheimer's disease, as we know from the animal studies, that you can actually manipulate the pathologies by manipulating sleep. And if that's the case, then it may not just be a sign, it might be an actual mechanistic feature which can be targeted with modifiable treatments. And sleep is a modifiable lifestyle factor. And this is, I think, a critical part of it, is that if you can target these modifiable lifestyle factors that are risk factors to Alzheimer's disease, you might be able to bend the curve a little bit and delay onset. And that can have a huge impact on the number of cases that ultimately are diagnosed.